Have recent healthcare changes impacted your practice? How much has it reduced your reimbursements? 25%? 50%? You are not alone. 1 out of 4 primary care physicians are reporting poor financial health. Among those, half had trouble covering costs resulting from falling reimbursements and the rising costs of practice. The Digital Bioscan Plus is a must in patient testing and monitoring. This is one of the most innovative medical devices in the medical industry. With over 60 clinical studies and 4 separate FDA filings, this medical device performs a range of tests that are covered and reimbursed by nearly all insurance companies. Over 45 million Americans have conditions and/or risk factors that qualify them to be tested by this device. The test is fast, non-invasive, and takes less than 8 minutes to complete. It measures arterial and nervous system function in human internal systems with remarkable accuracy. It helps medical providers identify and treat early signs of cardiovascular disease, peripheral artery disease, diabetes, neuropathy, along with many other diseases. The device has 4 FDA-approved technologies in one: pseudomotor heart rate variability, ankle brachial index, ABI, and pulse wave velocity. Pseudomotor assessment. Quick, easy-to-use galvanic skin response that assists medical providers in the understanding of microcirculation disorders and early signs of neuropathy. Pseudomotor dysfunction is caused by chronic diseases such as diabetes with high blood glucose, abnormal fat levels in the blood, and low levels of insulin. The pseudomotor testing clinical data suggests it may be the most sensitive means to detect peripheral small fiber neuropathy. Additional conditions identified by the pseudomotor assessment include the following: heart rate variability. Heart rate variability, HRV, and cardiac autonomic reflex tests, CARTs, or Ewing tests are performed concurrently with Valsalva ratio, deep breathing tests, change in posture, and difference in systolic pressure from sitting to standing position. The Digital Bioscan Plus performs the battery of tests recommended by the American Academy of Neurology since 1996. And the Cardiovascular Autonomic Neuropathy Subcommittee of the Toronto Consensus Panel on Diabetic Neuropathy for assessing the autonomic nervous system. Autonomic testing is recommended for all patients with type 2 diabetes at the time of the diagnosis, and 5 years after diagnosis in individuals with type 1 diabetes. A reduction of HRV and high score of autonomic regulation score have been associated with the early stages of cardiac autonomic neuropathy, CAN. The Ewing or cardiac autonomic reflex tests, CARTs, are recognized in order to diagnose cardiac autonomic neuropathy, CAN. Additional conditions identified by the HRV and CARTs test include the following: ankle brachial index, ABI. The Digital Bioscan Plus is the first valuable automated ankle brachial index measuring device based on oscillometric and pneumoplethysmography method. The blood pressure on the upper and lower extremities is measured simultaneously, resulting in the calculation of the ankle brachial index, ABI. The result of the examination is clear and straightforward, and only what is really important. The left ABI and right ABI are displayed. The ankle brachial index, ABI, was initially proposed for the non-invasive diagnosis of lower extremity peripheral artery disease, PAD, Carter 1967. However, it was later shown that the ABI is also an indicator of atherosclerosis and other vascular sites. It can serve as a prognostic marker for cardiovascular events and functional impairment, even in the absence of symptoms of PAD. The ABI results interpretation comes from the Guidelines for the Management of Patients with Peripheral Artery Disease, published by the Journal of the American College of Cardiology. Pulse Wave Velocity Assessment. Pulse wave velocity, PWV, is a measure of arterial stiffness, or the rate at which pressure waves move down the vessel. The pulse pressure waveform is provided from the cuff's inflation and deflation during the ankle brachial measurement. The augmentation index is a ratio calculated from the blood pressure waveform. It's a measure of wave reflection and arterial stiffness. Augmentation index is commonly accepted as a measure of the enhancement of central aortic pressure by a reflected pulse wave. Peripheral arterial disease, PAD, is a common manifestation of atherosclerotic vascular disease. Its incidence increases with age and in the presence of known cardiovascular risk factors, smoking and diabetes. Both symptomatic and asymptomatic diseases are associated with high risk of cardiovascular mortality and morbidity. Setup and operation of the Digital Bioscan Plus is as simple as connecting the patient to a few sensors and starting the assessment. The established clinical protocols for the all-in-one system requires the patient to complete a few actions, such as standing up, Valsalva maneuver, and paced breathing. The software communicates visually to patients using color-coded body models and graphs. The 8-minute evaluation and results are available immediately. Multiple visit comparisons can be made and graphed to monitor progress. It will provide a comprehensive written report with an outline of patient recommendations. The report is comprised of 2 key sections: a 2-page physician report, followed by a page of comments and recommendations based on clinical guidelines. The 5 key clinical sections provided within the report include: 1. Large arterial stiffness. 2. Ankle brachial index and pulse wave velocity. 3. Pseudomotor. 4. Heart rate variability. 5. CARTS Ewing test.
With the Digital Bioscan Plus system, you have a battery of tests that will bring to your fingertips as a clinician both early diagnostics and late diagnostics in specific disease processes that will then allow you to implement a therapeutic plan that both involves reversal of the disease process and further evaluation of advanced disease processes that require immediate attention.